Well, welcome everybody. My name is Jessica McDonald. I am the president of the League of Women Voters of Corvallis, and here today with April Holland, the Deputy Director of Public Health at Benton County. At the League, and I'm sure everywhere, we're getting questions from our members about the vaccine distribution. And we thought that providing a video, going straight to the source, talking to April, and getting questions answered would be a benefit not only to our members, but also to the wider community. And we're glad to have April here today to give an overview of both the vaccine distribution, answer some of the most common questions that are coming up, as well as directing viewers to resources to learn more. So thank you so much for being here, April. And I'm gonna share my screen with the PowerPoint and turn the virtual microphone over to you.
Thank you so much, Jessica, and thanks everyone. It's so nice to be here with the League of Women Voters. I'm a big fan of all that you do for our community. So the county here, we activated our Emergency Operations Center on January 13th to coordinate vaccine planning. The activation includes dozens of individuals working on items from plan development to logistics, getting the stuff we need, volunteer coordination to communications and finance. It includes people from the county and the city of Corvallis. We even have someone working with us from the Corvallis School District. So it's a great team. Equity is a North Star of our efforts here. We have a team specifically dedicated to addressing the needs of vulnerable populations and ensuring cultural responsiveness. The teams go through each detail of a vaccination plan to ensure that it can be implemented when sufficient vaccine is available, and they ensure that barriers are anticipated ahead of time. Next slide, please. So our vaccine operations could be divided into 4 branches. The first is our mass vaccine clinics, which are ongoing. And it's the means by which most of the vaccine is distributed at this time. As you may know, we have a partnership with Samaritan Health Services and Oregon State University to deliver vaccine at Research Stadium. We're in our 4th week of operation now, and it's easy for us to remember it's the 4th week because this is the first week that second doses will be allocated. There's a 28-day time window between first and second doses with Moderna vaccine. So that's a big piece of what we're doing and a piece that's currently in operation. The second branch would be the rural and the smaller clinics. We've been doing a lot of planning for not only our rural areas. So far, intense planning has been conducted for Alsea and Monroe clinics, as well as we're considering after-hours clinics for certain populations. We really don't want to leave out the needs of currently eligible childcare workers and looking ahead to essential workers. So we've got a tentative, our first tentative Saturday. It's not quite in stone yet, so I won't share any more details about it, but that is definitely something that's up and coming in our efforts. The third branch of our vaccine operations are mobile vaccinations. We do have partners, including pharmacies and primary care providers who are enrolled COVID-19 vaccine providers who have been willing and have been going out to facilities who require on-site vaccination, as well as to homes to accommodate people who can't leave their homes. This will become more robust as time goes on and we have more capacity to conduct this outreach. The final branch of vaccine operations is the one that's right in front of us and has been here all along. That's utilizing our existing infrastructure. So those enrolled vaccine providers, such as the primary care providers and pharmacies, who can utilize vaccine to administer it to their patient populations. Now, some of this is occurring now, but a big disclaimer on all of our planning efforts that I cannot ignore, and and need to place emphasis on is that all of it is dependent upon vaccine availability. Vaccine is scarce. Just for a frame of reference, we've got 16,600 estimated people over age 65 in Benton County. And we've been getting anywhere from 500 to 1,000 vaccine doses per week so far. So there are many more people eligible for vaccine than there are doses available. Next slide, please. Okay, I think I went over this one pretty well. I do want to add that we are using our vaccine allotments very quickly after we receive them. So we are not setting aside doses of vaccine for second doses. We receive identical doses from the first allocation of shots when the time is right for a second allocation. Now, the one sort of piece of that varies in this is that we just started setting aside some vaccine for our rural clinics. So we will have a small amount of vaccine in our freezers to accommodate clinics in Alsea and Monroe, but those won't sit there for very long, and those are slated to happen in March. Next slide, please. Okay, so it feels like we've gone through a lot of time and a lot of eligibility groups, but in truth, the bulk of the work lies ahead of us. I mean, right now we've had about 15% of the Benton County population as a whole has been vaccinated, which is great. Oregon is at about 13%, and so we're tracking slightly higher for Benton County residents. We started back in December with phase 1A, and that group includes healthcare providers, people with diverse intellectual and developmental needs, caregivers of medically fragile individuals, traditional health workers, death care workers, a large emergency responders. It's a large group, and we estimated to have somewhere around 8,600 to 9,000 in that group in Benton County. Then we moved along to the beginnings of phase 1B, and that started with educators. So that was birth through grade 12 educators. And then began to week by week, starting February 8th with the age bands of first 80 and above, 75 and above, 70 and above. And that's where we are now is all of phase 1A, the educators and everyone aged 70 and older is currently eligible. Next Monday, eligibility will open to ages 65 and older. And then, moving forward, the next groups, as I said, they'll be large. They'll include essential workers and people with underlying health conditions. But dates for these additional groups have not yet been announced. It will take time to vaccinate this really large group of eligible individuals. And Governor Brown has estimated that we'll reach the goal of vaccinating about 75% of those eligible and willing by the end of April. So I don't anticipate that in the next few days we'll see new groups opening up, and that's subject to change as well as things change quickly in pandemic. Next slide, please. Yes, so I would really like to talk about how we consider vulnerable populations in our rollout and how we ensure that we have cultural responsiveness. I've got several points here. Our vulnerable populations and access team is looking ahead to anticipate barriers in current and upcoming eligibility groups. The team has created a really impressive matrix of barriers and is looking ahead to address them. I'd like to share as an example some planning for when people experiencing homelessness are eligible for vaccination. The team was able to insert a question into the annual point in time count of people experiencing houselessness, which estimates the number of sheltered and unsheltered persons living in the community. Each person who was counted and interviewed was asked if they would be willing to accept a vaccine. Outreach is also underway to determine higher risk individuals, including those with underlying conditions within this group. A plan for vaccination for people experiencing homelessness would include collaboration of trusted partners, and it would likely have a mobile component as well. Second, I want to share how we continue to anticipate and meet the need of our residents over age 65, 65 and above. Um, uh, One major barrier to some in this group is technology. Our call center here at the county and our emergency operations center liaison teams are both engaged in meeting this need. And Samaritan Health Centers has opened a call center as well. We also understand that many seniors may prefer to hear from a trusted provider. So we invite primary care partners to participate, ensuring that their patients are scheduled into mass vaccine clinics and into our survey if appointments are not currently available. As to the additional considerations of people over 65, the Reeser mass vaccine site is equipped to meet the mobility and access needs of this population. We've got golf cart service from the parking lot. We've got VIP lanes for direct service for those who need it. We've got concierge service, people meeting folks at the curb and taking them through the entire process if that's what they need. I'll address this more in a minute, but we've got transportation available for people. And importantly, we've also relaxed the overall rate of vaccination so no one feels like they have to rush through. As to language considerations, we strive to provide translation of materials into Spanish. We do have interpreters on site as well. A lot of the required forms are available in several languages, but we also rely on live remote interpretation via an app and using an iPad for additional languages, including American Sign Language. And before moving on, I want to share that the Vulnerable Populations and Access team is also working to launch a Vaccine Confidence Coalition. Right now, vaccine is scarce. And so we're seeing everyone who really wants vaccine now, at some point, we'll have adequate vaccine and we'll need to be able to pivot to just demonstrating the importance of taking vaccine, the safety aspects of vaccine. And this coalition should launch about mid-March, and it will include members from Partners in Healthcare, from Black, Indigenous, and people of color communities, from the Latinx and farm worker community. It'll include faith partners, people who are unhoused and who serve those who are unhoused, representatives from the LGBTQ plus community, as well as the general population. Next slide, please. Yeah, so everyone wants to know how to get a vaccine. We've got a system down, and we continue to improve and pivot as needed. We conduct outreach to agencies, to facilities, to healthcare providers, and to people directly when we know that they're within a certain age, within a certain eligibility group. We also solicit information from eligible persons through our vaccine needs survey. The way this works is our eligible community members complete the survey. They'll receive a confirmation email. When a scheduling opportunity arises, an email is sent that includes a scheduler link with instructions. And the submissions are prioritized as much as is practical according to the OHA phasing. This doesn't mean that all in groups who become eligible first will receive vaccination before anyone else. We do phase out our scheduling, the sharing of the scheduling links by eligibility group. Sometimes our turnaround is quite short from the time we know we're receiving vaccine and when a schedule is opened to when the vaccine clinic is actually taking place. So at times this compressed time frame does not allow for perfect prioritization, but we do our best. The only other thing I want to mention there is that it's not a one-time opportunity. People will continue to receive that scheduling link from Benton County every week until they either hit the unsubmit button or until we know that they've been scheduled. And there is a separate process for people who have indicated that they don't have an email address. Our survey now opens up an additional few questions to get information so that we may schedule people directly, and then we call them to let them know that their appointment has been scheduled. So we are working to accommodate and meet the needs of those folks. Next slide, please. So after you get the vaccine, what could you expect? I do want to say that both currently available vaccines have undergone rigorous testing and through large clinical trials. They've both been found very effective and do an excellent job of preventing death and severe illness. We know right now we have the Pfizer and Moderna vaccines. Common side effects of these, they can affect the ability for people to do daily activities, but they should go away in a few days. Common effects include pain and swelling at the injection site. Some people also feel tired. They might have a fever, headache, or chills. These are normal signs that the immune system is working to build protection. And these side effects generally last for 24 to 48 hours. If the redness or tenderness where you got the shot increases after 24 hours, or if your side effects are worrying, or that they don't seem to be going away within a few days, call your healthcare provider. For discomfort at the injection site, things that may help are putting a cool compress, such as a clean wet washcloth on the site, and using that arm. People can also take over-the-counter fever reducers if they have a fever and if that increases their comfort. They can also dress lightly and drink plenty of fluids. Next slide, please. All right, so our locations right now, I'd say about 80% of our vaccine currently is going to our mass vaccination site at Research Stadium. Some vaccine is being distributed to pharmacies and primary care providers, but the volume of this vaccine is small due to the continued limited supply. Recently, a federal retail pharmacy program began that includes the 3 Safeway pharmacies in Corvallis. They're receiving currently 100 doses per week each, and those are anticipated to increase very soon, but I don't yet have the details on that. But in the next few weeks, we may see a 50% increase or a doubling. And a state retail pharmacy program will be implemented soon that will include pharmacies such as Fred Meyer, Bi-Mart, and Costco. This is not yet operationalized, and this would be handled by the state. Additionally, a new federal program will distribute vaccine to federally qualified healthcare centers, which will include our 5 community health centers that Benton County runs. So we're really looking forward to having the day come when vaccine is plentiful and all vaccine providing partners can have everything that they need. We are learning and expecting that vaccine availability will be increasing soon. We're just on the cusp of learning what that means, and I'd be happy to broadcast that news as soon as we know more. I'll just include briefly, today's the 24th of February, and at the end of this week is a meeting to determine whether a new vaccine may be granted emergency use authorization. This is the Johnson & Johnson vaccine, and the data appear to point to the fact that it is likely that it will be approved and added to our complement of vaccines. We're not sure yet exactly how many that will bring to us, but we know that it's looking good that we'll have a new vaccine to add to the mix soon. Next question, or next slide, please.
Well, before we advance, I just have a follow-up question. If somebody takes the survey, is that only related to the mass vaccination clinics, or does that also set you up with potentially like a retail pharmacy opening when they have them? Or do people go directly to those pharmacies?
That's a great question. Right now, our survey creates a wait list more or less for the mass vaccine clinic only. We're not sharing that information out with the pharmacies. And right now the numbers are limited such that pharmacies are reaching out to their established patient populations at this time. And they've got their own separate scheduling systems that they use. Yeah, so scheduling vaccine appointments is, I think I briefly discussed the process for getting registered, but people can register at additional sites outside of our county. We share our scheduling links with Lynn and Lincoln County, and we are welcome to schedule into those vaccine opportunities as well. People may also call 211 at the state level and get information potentially about vaccine availability and opportunities. One important note there is that people should be prepared to return to the same site where they received the first dose for the second dose. As to whether people can pre-register, there's not a specific pre-registration that is able to be accommodated within the system that's used at the mass vaccine clinic. However, the one exception would be if people indicate that they can't be contacted by email. The information would come through the survey. It's not truly a pre-registration. It's more of a wait list with a little more details included. I hope that we may be able to accommodate pre-registration at some point in the future. Next slide, please.
A follow-up question is, say for Benton County, when you have people scheduling through the survey or taking the survey, do you prioritize people from Benton County if others are also enrolling outside of Benton County or Lane or Douglas or something? And does that happen, or is there a prioritization there?
Well, we don't prioritize for the address of the person submitting the survey, and neither do our regional partners. Where we do really attempt to prioritize is by eligibility. So we will go back and when a scheduling opportunity arises, I touched on this briefly earlier, but I think expanding the process a little better might be useful. We'll first review everyone we've received a submission from who's in the phase 1A category, that first group that was eligible. We will send those scheduling links and make that outreach before we move on to the next group and the next group. But in terms of prioritizing residents, We haven't at this point determined that we have a huge effect. Our total number of vaccines administered and our total number of people who live in Benton County who have been vaccinated really tracks well. So I think that the system is working for now, but we'll definitely keep an eye on it.
Thank you.
Thanks. When someone wants to change or cancel their vaccine appointment, and this would only apply to the mass vaccine clinic, the Samaritan call center, because they have access to the insides of the system, can handle that. The number is listed on the screen here. Canceling an appointment doesn't, detract from. There's no penalization, for applied to anyone for canceling, but they would have to wait until the next schedule is open to get in again. Next slide. Thanks. Oh yeah, so I mentioned earlier about transit options. Dial-a-Bus, Benton Dial-a-Bus has really stepped up. They're a great partner, and they continue to be a great partner in offering free rides to and from clinics for people with the different developmental or intellectual needs, and for people age 65 and up. And unlike some of their ride opportunities, registration as a client isn't required in this case. The number there is listed for your reference. And the Corvallis transit system, as you know, is a no fee transit system. There's a bus stop at Research Stadium right on their Route 3. There are a lot of questions about the cost to get vaccinated. And I want to dispel the myth that I want to let you know that no one will ask you for any money. You will not receive a bill. You will not have to pay a copay to get a COVID vaccine. At some providers' offices and at the mass vaccine clinic, if you have an insurance card, your insurance company can be billed for a small administration fee. I think it's about $20, but it will never come out of pocket from someone who's getting a vaccine. Next slide. Oh, and the big question is when can we go back to normal life? And we're all looking forward to going out to the gym, to flying, to go on vacations, to have people in our homes, and to get on with something that feels more normal. We're on that path, and so that's really great. Herd immunity or community immunity happens when a sufficient proportion of a population is immune to an infectious disease through vaccination or through prior illness. Our goal is to make the spread from person to person unlikely. And vaccines are the way to do this, because vaccines create immunity while allowing free spread really just causes unnecessary deaths and more cases. As to what the proportion of the population that must be vaccinated against COVID-19 to begin inducing herd immunity, it's not really yet known. We do have some examples from history that can give us some clues, and I know scientists are working on determining, our number here for COVID-19. But measles, which is one of the most communicable diseases, requires about 95% vaccination, while a disease like polio requires about 80%. So the percentage for COVID-19 is probably somewhere in that range between 80 and 95%. While we still have a long way to go, the great news is that vaccines prevent death and severe illness. And after losing more than 500,000 souls in the US to this disease, that's really something to celebrate. If anyone would like to keep up on information, you can join us at on the Benton County website. There's an opportunity there for you to enter in your email address to receive updates. You can also access our vaccine needs survey there, and check the site often. Find us on social media. We're really updating and changing as the information we receive increases. And yeah, thank you so much for your time. I'd be happy to answer any additional questions you have, Jessica.
All right, thank you so much, April. We had sent April a long list of questions, and I'm sure they're not unique questions. They're certainly ones that the county is dealing with and receiving and responding to. And this presentation really covered almost every single bullet point and question that we sent. I have a couple of follow-up questions as I look back through the list of questions that some of our members had thought about and compiled. And one of those was, we hear these things about maybe at a pharmacy or at a mass clinic, if there are no-shows, can there's this kind of rumor you can go and wait for no-shows and see if you can kind of step into place in their line. What is the reality there? What does that look like?
Thank you for bringing that up, Jessica. I would be remiss without bringing this up. So we don't encourage walk-up appointments. While there may be very limited number of doses from no-show appointments, we try to accommodate that in our scheduling. And occasionally the clinical staff at the mass vaccine appointments during a clinic day, they may present an opportunity to a small number of individuals, but it is a very, very small number, and we actively discourage people from showing up. One good way to perhaps have an opportunity for vaccination if you're not in a currently eligible group is to get involved with vaccination efforts. Not every volunteer is vaccinated, but if someone is with us for a period of time and there happens to be an opportunity, then we may be able to take advantage of that opportunity, but only in the case of a bonus dose that would otherwise go to waste.
Okay, thank you for answering that.
Sure.
We had another question about what this might look like in the future in terms of, one, does it seem like there might need to be an additional booster shot that happens maybe sometime later in the year for individuals that have received the vaccine? But also in the future, does this become something like the flu shot, which is received annually?
Yeah, that's a really good question. And scientists are still uncertain whether infection whether infection or vaccination for that matter provides long-term protection from the virus. But I do think that we'll see boosters in our future. Just not sure what exactly that'll look like. There have not been, yet any formal recommendations made on the timing or the is continuing to come in, and it's continually analyzed, and we'll continue to just adjust as needed. And yeah, we'll share more as we have more information.
Great. I know that I signed up both where I live, but also for updates, just email updates, but also where other family members are, just so I can kind of keep track in those counties. And I really appreciate Benton County's efforts and getting those email updates open to the public so that as things change inevitably and new information comes along, there's always opportunities to just stay updated. And so thank you so much. I wanted to just open if there's any final thoughts that you had before we end today that you wanted to share.
Thank you. It's been so nice to share this information with you, and I'd be happy to speak again with your group. Um, I just want to reiterate what I said earlier about, the it's hard to keep our glasses half full when we're continuing and we have a continual need to maintain vigilance and practice our non-pharmaceutical interventions of maintaining distance and wearing our masks and just being as safe as we possibly can. Um, we're going to get there. We have vaccines that prevent death and severe illness, and we just have to hang on for a little while longer. It's going to get better.
Thank you for those inspiring and hopeful words for 2021, the year ahead, and to vaccine distribution and to public health. Cheers to that. So thank you so much. And we'll take you up on that offer to maybe circle back as new information comes available and have opportunities for more education. Thank you very much, April.
Thank you, Jessica.